Prasanna to present on a 4D holographic model or metaverse with augmented reality with respect to glaucoma.
Shishir sir, can you join the dais? So thank you once again, Team Yosi, for this opportunity. I'm just going to share my original work in the field of ophthalmology that I have done, and this is my literature. So this is one that you would have seen in movies, which really inspired me to get this innovation, and I'm trying to refine this innovation every year as we speak. So I call it the 4D ophthalmic metaverse. Can I have a laser pointer if it's available, please? Yeah, laser. So I also have a patent for the same, and these are the 6 facets I'm going to cover. Okay. இல்லை இல்லை வேணாம் வேணாம் நான் வீடியோ மூவ் பண்ணுவேன் பாயிண்டர் மட்டும் இருக்கான்னு பாருங்கள். So for me, this metaverse really started with animations. Being a glaucomatologist, can we show what is the difference between a peripheral anterior synechiae, which is pathological, and an iris process, which is actually physiological? So that is the questions that really started, and I take them into a real world scenario, then showing how the iris process is very fine and doesn't cause any issue to the structures below them, and the PAS, which is very broad basal, and trying to convey concepts like a 10-second video showing pupillary block causing an acute angle closure. So Team Yosi is also coming up with a lot of this video capsule books tomorrow. We are launching one as well on this. But here you can see the work started with a cause here and an effect here, because the aqueous is not able to flow through this. So I started my journey with a lot of animations, and I'm still doing a lot of videos on this. And this is one such video of the whole glaucoma in a single minute. You see, this is my own patient's image where you can show a vertical cupping, increased vertical cup disc ratio, and in a single image, I'm just zooming in and showing the notching now. Then I'm zooming in and showing the bionetting sign now. I'm zooming in and showing the ISNT rule, which is breached. And then again I'm zooming in, or rather I'm zooming out now and showing the RNFL defect, and then showing the structure function correlation. The structure is here, the function is coming on top, and arcuate scotoma is there. Then finally I'm zooming out, putting the OCT on top, reducing the transparency, showing the ganglion defect as well as the RNFL defect. So this is a single minute video, and I started my journey with a lot of these videos, and some of them are published in PubMed Index journal like the Indian Journal of Ophthalmology video section. And to name n number of videos like ALT versus SLT, how you need to deliver the spot, argon laser peripheral iridoplasty, where you do it for oppositional angle closure and you open up the angle which is opposed. So you saw a cross sectional view. This is a front on view. So the journey took me into a zone where can I give all the sectional views, a cross sectional view, front on view, a gonioscopic view of ALPI, argon laser peripheral iridoplasty, where you see that the spot is hit somewhere slightly away from the periphery and the oppositional angle actually opens up, causing the angle to open. And it started in a simple YouTube, and this is my channel. You can still follow my work in my channel named as my name itself, Prasanna Venkatesh Ramesh. I have currently 70 plus videos like this on animations, and to have a name a few again, after cataract extraction, see how the iris falls back, see how the vectoral forces of the ciliary bodies falls back, the zonules, ciliary body, and see even how the scleral spur falls back, because the lens is removed, right? And even if there is a PAS, sometimes it falls back when you place an IOL, a simple cataract surgery. So that pushed me into further and further refinements, like I started creating my own models into circle of Willis that you can see here, cavernous sinus, and then the eyeball model also for that matter. And that pushed me into a boundary of innovations, where this was my second one, where I made a lot of button related innovations, that you can choose the frame that you want, because teaching as such, we were not restricted, or we were restricted with the images that the author wanted us to see. But can we really create a model where the user is choosing the point of visualization that he wants to see, he or she, like the trabecular meshwork that is seen here. And the same goes for the fundus, along with color, autofluorescence, and infrared, because the users are given the power to choose the frame of choice that they want, and the models were continuously fed the different case sheets. You can see with all these are my own patients' data, which were fed into these models, and that became an atlas or a complete version of a whole ophthalmological curriculum. And this is also published, and that pushed me to my third innovation of augmented reality. So I felt buttons also had its own restrictions, but if I am able to do something fully innovative with a hologram, this is a mobile camera view where he is showing how on day one a neophyte can see how what a retinal surgeon sees, what a mixed surgeon sees, the angle, the retinal architecture, and whatnot. And even undissectable structures like the cavernous sinus, the circle of Willis. Uh, I sat with the Cunninghams, read it, created it in 3D, and you can actually get to visualize the same. And slowly but steadily, all the pathologies like NTG or even RNFL defects in POAG, they were also uploaded in this, along with the color fundus, autofluorescence, and infrared. And the user was given complete choice because he just needs to move his phone front and back. And this was published in the European Journal. And the other phase which pushed me further was the headsets. You have the HoloLens, the Oculus. See my friend here examining the whole patient's case sheet. You can go in now, expand it, Miyake Apple view, angle view. If you zoom in more, you get the pores of the trabecular meshwork and whatnot. And also a whole EMR of the same case sheets that I showed you in the phone. It can be examined in a splinter hemorrhage. See how moving his fingers and examining the splinter hemorrhage of this particular patient. And also in the other case of RNFL, which I am going to show you now. See how he is moving his fingers there in this area, and he is beautifully demonstrating the RNFL defect. See, he is moving his fingers, and he can show the extent, and this is what he sees. This is what we see from outside. So I feel it's a limitless boundary where I'm adding OCT filters now. For posterior polar cataract, hydrodissection, hydrodelineation, training can be done with holograms. 4D multimodal imaging with all these imaging sectors are paving a huge way in the neuro-ophthalmic pedagogy, especially which are very confusing and very difficult to read in anatomy. And this is my museum at my workplace where I have created. You just need to put the headset in an empty room and you get it all. And I always believe in publishing my work, and this is my daughter creating her own museum for herself. These are the Gen Z kids who are going to come with these kind of tools for innovative learning. And just to summarize, I am just currently working on one of this very ambitious project of mine where I am trying to incorporate the OCT in the funduses. So where you can actually extrapolate the OCT out from the fundus, and you can choose the slice that you want to examine, and deliver better three-dimensional examination, because currently we are doing examination on a 2D scale, not on a 3D scale. So striate keratopathy, Christmas tree cataracts, or any cataract for that matter, you can keep going endless amount of cases, and I've made sure I've delivered it in all platforms. So this is the recent simulation that we have brought out. Very recent one is the MIGS simulator. So again, see here, my dear friends, this is how his hands will look through his eyes, and not once but twice he can practice a very costlier implantation, an eye stent implantation, which is not very readily available, not once, twice, but multiple times, and you can go and have a successful implantation. So this, my dear friends, is the future, and thank you once again, Team Yossi, for giving me this wonderful opportunity to talk on my original work on what is happening, cutting edge research in AR, MR, VR, and also to an extent 3D printing. So I am Dr. Prasanna Venkatesh Ramesh. So I'll just go to the thank you slide here, and I also like to acknowledge my team, and you can catch me in these areas. This is my Instagram ID as well as my models. So for want of time, I am not showing the other slides. I just want to go to the last slide of mine, and let me see if I'm lucky to go to the last slide. Yes. So thank you Yossi once again, and any questions or any doubts, happy to share. Thank you.
As always, Prasanna, wonderful presentation and great work that you do.
Thank you, sir.
I think incorporating technology and medical, together. But how graphic intensive is this in terms of your, CPU requirements is something that GPU requirements more, I think. And
Everything, sir.
yeah,
Apparently. Even the financial requirements also, sir, unfortunately.
Of course, certainly. But these models are now available for people to use, or
Yes.
how
Readily
do they?
available, sir. Sir, actually we have cracked it in Android as well as Apple. In Apple, we have named it as IMG Max, EYE space MG space Max, and anybody can download it today free of cost. And the other application that we have done in the HoloLens, it's like a WhatsApp, sir. The application has been made by us. If a teaching institute has a Oculus, every institute's curriculum today is compulsory that they should have a headset like an Oculus or a HoloLens, or Geo is also coming out with their own. So the app is ready. We have launched the app and we have put it in the cloud. So if they have a lens with HoloLens or an Oculus, they can download the app and they can get it. As of now, I haven't charged it, sir, because it's again too difficult for students to access this if I keep a charge on it. So just like WhatsApp, they just can install it and they can use it, sir. So as of now, that's how it is.
Wonderful. And the 4D part of it is so 3D of course is understandable, but 4D is what is
It's a good question, sir. Actually, I was asked in this question in an Apple Tree presentation when I presented this there. So there is a pseudo haptic sensation. That's what they say. So when you touch the HoloLens, I mean the model, you will have a click sensation in your ear. I would relate it to the touch that you do on your phone when you don't put your phone in the silent mode.
Yeah.
When you touch, you are actually only touching, but the sound click, click, tick, 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 that makes you feel actually you are typing, but actually you are only touching. So similarly, when you catch the instrument or when you are trying to do a exercise, currently I am working on a vertical chop and a horizontal chop. So when you touch it, you will have a click sensation mimicking that you have actually touched it, but it is a pseudo touch. We can call it as either a pseudo 4D also. The real touch would be the one that Help Me See is really having in them, or the VR headsets that Fidelis is also launched, Alcon Fidelis. So that is something like a real one. This is more like a pseudo touch, sir.
That headset itself is quite a
Yes, sir. Yes, sir.
but
It's a very pertinent question, sir, because that's why I wanted to compare it with a smartphone. When you put your phone in not a silent mode and when you try to click, that is the exact sensation you will feel when you touch and move around. Yeah. Thank you, sir.